So, with the passing of the One Big Beautiful Bill, there is yet another attempt to defund Planned Parenthood. Now, it doesn't specifically in the language say Planned Parenthood, but you'll be able to pick up on once we read it. Like, yeah, that's exactly who they're going after here. Anyways, so that went through and that was signed by Trump, but we now have a federal judge temporarily blocking that. So, and if you also don't know, Planned Parenthood provides a lot of services that we're going to go over at the end of the video. You can use the timestamps below to skip to that, or you can just watch to that point. Anyways, let's read the article and then get into it. So, judge temporarily blocks Trump administration from enforcing funding ban against Planned Parenthood. A federal judge on Monday temporarily blocked the Trump administration from enforcing a provision of President Donald Trump's sweeping domestic policy law to defund Planned Parenthood's healthcare services. The order from U.S. District Judge Indira Tawani, an appointee of former President Barack Obama, because we always have to bring up who is blocking it and who they were appointed by, because judiciary has been completely politicized. So anyways, they blocked the provision enforcement for 14 days. The measure would bar Medicaid users from coverage with a healthcare provider that also provides abortion services. So that's where the language of the bill comes from. That's what it says. It's not saying, yeah, defund Planned Parenthood. Is saying to bar Medicaid users from going to a healthcare provider that also provides abortion services. Now, that can affect a lot more than just Planned Parenthood, but I think Planned Parenthood is definitely going to be the biggest victim here of this. So that's blocked for now. And back to this Obama appointed judge thing, like, we need to stop with this. Like, it's starting to concede to the Republican framing that all these judges are only doing it because they were appointed by a Democrat or are left-wing lunatics, when time and time again, we've had Bush appointed judges, we've had even Trump appointed judges block his injunctions because they are illegal. Let's be clear on that. It's not some conspiracy that the deep state or the judiciary is out to get you. You just happen to be issuing a lot of illegal orders and just things in general. Anywho, the Planned Parenthood Federation of America, along with Planned Parenthood League of Massachusetts and Planned Parenthood Association of Utah, sued the administration earlier Monday, arguing that the funding ban would have devastating consequences across the country. While the legislation, which Trump signed on Friday, does not explicitly mention Planned Parenthood, the nationwide family planning and healthcare provider is in its crosshairs. The law prohibits federal funding for providers primarily engaged in family planning services, reproductive health, and related medical care that also provide abortion. Planned Parenthood has warned that nearly 200 clinics nationwide, which also provide birth control, STI testing and treatment, and cancer screening, could close as a result of the bill's one-year ban on funds. 90% of those clinics, Planned Parenthood says, are in states where abortion is legal. This is another thing which is just going to have disastrous consequences, because it's already, since this bill was signed into law, it's already a open and shut case closed fact that dozens, hundreds of rural hospitals and medical providers are going to have to shut down because of the funding cuts. Now you have Planned Parenthood is most likely going to have to shut down a lot of clinics. And again, as this article mentioned, they do a lot more than just abortion care. Like, it's so frustrating, man. And when you have all these places closed down, the places that are still open are going to be swamped. And your wait times, which are probably already shitty, are going to be even more shitty. Your healthcare that's already expensive is probably going to be more expensive. And people, as with the passing of a lot of the provisions of this big, beautiful bill, the fact of the matter is people are going to die. Let's just say it how it is, okay? This case is about making sure that patients who use Medicaid as their insurance to get birth control, cancer screenings, and STI testing and treatment can continue to do so at their local Planned Parenthood health center, and we will make that clear in court, Alexis Miguel Johnson, president and CEO of Planned Parenthood Federation of America, said in a statement. The bill originally barred funds for 10 years, holy moly, before the Senate parliamentarian Elizabeth McDonough reduced the measure to 1 year. Planned Parenthood Federation of America and two local networks celebrated Monday's order while warning in a statement the consequences if the provision is ultimately allowed to take effect. Already in states across the country, providers and healthcare center staff have been forced to turn away patients who use Medicaid to get basic sexual and reproductive health care because President Trump and his backers in Congress passed a law to block them from going to Planned Parenthood. The group said there are no other providers who can fill the gap if the defunding of Planned Parenthood is allowed to stand. The defunding. I think I said funding there. CNN has reached out to the Department of Health and Human Services and the Centers for Medicare and Medicaid Services for comment. Earlier Monday, anti-abortion advocates quickly railed against Planned Parenthood's suit. Planned Parenthood's desperation is showing as they run to the courts again to fix a crisis of their own making. What do you mean a crisis of their own making? Like providing health care to people? Jesus Christ, man, these people are sick. Said Susan B. Anthony's Pro-Life America Director of Legal Affairs and Policy Counsel, Katie Daniel. Oh my God. These people are pathetic. Just stay out of people's healthcare. Stay out of people's doctor's office. Just stay out of it. You're celebrating the fact that people will die if they lose this lawsuit and essentially lose their funding. These people are sick. Fucking sick. Planned Parenthood is also battling the Trump administration in court over a cut to federal teen pregnancy prevention program. Lawyers for 5 Planned Parenthood networks argued in a federal district of Columbia court this June that administration changes to the program, including limits on language around diversity and equity, were vague and could bar Planned Parenthood from providing long-term services. Real quick, let's go over the key functions of Planned Parenthood and how much it actually costs us, the taxpayers. So key functions of Planned Parenthood: sexual and reproductive health services. They provide birth control, emergency contraception, STI testing and treatment, HIV services, pregnancy testing and counseling, and vasectomies. Offers cancer screening, cervical, breast, well woman exams, vaccines, infertility services, and some prenatal and postpartum care. Abortion care and counseling, is where it gets spooky to the Republicans, performs both medical and surgical abortions where legal, also provides referrals and information. Sex education and advocacy, conducts community-based and online sex education, including services for LGBTQ plus populations. Oh no, God forbid we serve the LGBTQ plus. Advocates publicly and legally for reproductive rights, including abortion access and opposing restrictive laws. Gender affirming and mental health supports transgender, non-binary patients with hormone care and referrals. Some clinics offer mental health services and referrals. Clinic network and research support. Coordinates 600 U.S. health centers under PPFA, supports affiliates, contributes to reproductive research, and helps set care standards. So approximately $792 million in government-provided health services. Essentially, they get $792 million from the federal government. And let's see, they also get, what is this, from I assume this is people using Medicare and Medicaid, $1.5 billion. So we'll be generous and say, let's say they get $2 billion of our tax dollars, even though that's a way up estimate. For reference, $40 billion would be less than 1% of our budget. And this is $2 billion, which is probably overstating it a little bit, but I'm being generous. And this is a service that is, at least to the pockets of the taxpayer and the government, so cheap, such little funding, and it provides such an important role and an important service. And remember, this is all passed alongside a bill that cuts a total of like $1 trillion from your healthcare. And I think it's important that you remember that $40 billion to ICE and mass deportations, that increase, that's been deemed more important than your healthcare. The $150 billion increase to our Pentagon and military budget, that is more important than your healthcare to these people. And you should not accept that. You shouldn't be cheering this on. People are going to die as a result of this if the funding does indeed get cut. And how much longer are we going to stand for this and just let this happen and be like, oh, okay, like, wake up, wake the fuck up. This is just ridiculous. Anyways, let me know what you think in the comment section down below, and I will see you in the next one. If you made it to this point in the video, I just want to give a special thank you. If you enjoyed it, please hit that like button down below. And if you really enjoyed it, maybe consider hitting that subscribe button while you're down there. I want to hear your thoughts in the comment section. I will try to reply to any and all comments that I can. Until next time, watch that video on screen.